everyone. So today we're going to talk about the central nervous system trauma. And central nervous system trauma is actually the trauma to the brain and spinal cord, and that is lethal. So when the brain is damaged, the injuries may involve the parenchyma or the vasculature or both. So that's why the CNS trauma is further divided into traumatic parenchymal injuries and the traumatic vascular injuries. So talking about the traumatic parenchymal injuries, you must know the COP and the counter-COP injury. COP is basically the head injury, brain injury that occur at the site of impact is the COP, and that occur on the opposite side of impact, that is the counter-COP. And these two lesions are actually the contusion. Contusion is the bruise of a brain tissue, and this is caused by the rapid tissue displacement, disruption of the vascular channel, subsequent hemorrhage or edema. As it lies closest to the skull, so the crusts of gyri, they are more susceptible because they lie closest to the skull, and the common regions that involve the brain are those that are rough and irregular. So if morphologically, if you see, so grossly you can see a wedge-shaped structure, and the the widest part of that wedge lies closest to the point of impact, and the blood extravasates. So in the acute contusions, you can see area of hemorrhage and the tissue disruption, and in the chronic contusions, you can see a discolored yellow areas or brown patches, and these lesions actually show the gliosis and residual hemosiderin laden macrophages. And if you talk about the microscopic features, so you can see the cellular disintegration, nuclear pyknosis, and eosinophilia. So talking about the concussion is the reversible altered brain function with or without loss of consciousness. So let's talk about the traumatic vascular injury. In traumatic vascular injury, we're going to discuss three things: epidural hematoma, subdural hematoma, and the subarachnoid hemorrhage. Talking about the epidural hematoma, hematoma is actually the collection of blood, and epidural hematoma is the collection of blood in the parenchymal space between dura and the skull. Epidural hematoma it occurs rarely in 1 to 4% cases of the head trauma, and it often occurs at the pterion. You all know pterion is the thinnest portion of the lateral skull, and epidural hematoma is caused by the traumatic injury to the middle meningeal artery. When the middle meningeal artery ruptures, it causes blood to enter into the epidural space, and as the dura is firmly affixed to the suture lines, it inhibits the blood from crossing and expanding inwardly. So on contrast CT, you can see a hyperdense, bright, biconvex or a lenticular shaped structure, and that is because the blood is trapped between the dural suture lines. And the patient of the epidural hematoma presents with the lucid interval. It is a period of the normal neurologic function immediately following the injury, and increased intracranial pressure due to the intracranial hemorrhage can present, and it can cause the severe headache, mental status and syncope, nausea and vomiting, and transtentorial herniation. And transtentorial herniation is the serious complication of the epidural hematoma. Subdural hematoma is the collection of blood underneath the dura. It is the hemorrhage into the potential space between dura and the arachnoid matter, and it is caused by tearing or bridging veins that drain the cortex into the dural sinuses, usually by sudden acceleration deceleration injuries. And it is common in the shaken baby syndrome or any other kind of the child abuse, and due to thin-walled bridging veins. And it is also common in the cerebral atrophy. Cerebral atrophy is caused by three reasons: chronic alcoholism, age, and neurodegenerative diseases. And in the cerebral atrophy, there is increase in the distance traveled by the bridging veins that leads to increased tension and higher risk of subdural hematoma. As compared to the epidural hematoma, the blood is not contained by the suture lines, allowing them to expand along the skull. On contrast, non-contrast CT, you can see a hyperdense, bright, crescent appearance. Next is the subarachnoid hemorrhage. Subarachnoid hemorrhage causes bleeding into CSF space between the arachnoid and the pia mater, and pia or pia mater, whatever it is. Two important causes of the subarachnoid hemorrhage is the vascular abnormalities and the trauma, and the most important occurs due to the rupture of the barrianeurysm or secular cerebral artery aneurysm. One important thing that the patient presents with the thunderclap headaches. The patient says it's the worst headache of my life. And in on the non-contrast CT, you can see a hyperdense white material filling the subarachnoid space, especially near the circle of Willis. Okay, so CSF following the lumbar puncture will show increased RBC count and the xanthochromia. And xanthochromia is the pinkish yellow tint to CSF due to hemoglobin breakdown products. And those hemoglobin breakdown products in the CSF following the subarachnoid hemorrhage can cause the endothelial irritation and vasospasm. And that vasospasm can cause ischemic stroke.